Okay, welcome everyone. We're just shy of a quorum, but I'm sure we will have one. But let's get the meeting started. This is the meeting of the Public Health and Safety Committee. I will call the meeting to order. I'm going to not discuss at this point the minutes because I want to make sure we have a quorum to vote on that. So why don't we jump right ahead with David Knopf, our Darien's Health Director. David, you're there, and David's going to do a little presentation on the current aspect of COVID in our town and other aspects of public health and safety. Thank you.
Good evening. Thank you, Mac, and thanks all. I am currently on board the Port Jefferson Ferry, and so there may be some interruptions with transmission as we go forward, and there's probably a fair amount of ambient noise, which I can't very well tell the passengers to be quiet. I could try it, but probably wouldn't work too well. So anyway, where are we in the COVID fight right now? It's kind of we're absolutely in a uptick in terms of numbers of cases. I think that Mac, you said you circulated the last week's
yes
weekly summary to everyone. Okay, we're going to have a new one coming out tomorrow, so we'll see what happened in the past week. But we're still seeing quite a few cases, and the numbers are up from where they were 3 weeks ago. I think the good news is that nobody's particularly seriously ill. We're seeing cases that are described as mild cold-like symptoms, or fever, or both, and which tend to resolve rapidly. So that's the good news. We're not
any hospitalizations that you know of?
No, I don't know of any, because we reach out to each positive case. And the last hospitalization I know that was directly related to COVID was a year ago. We've had some people who've gone to the hospital for other things and have been tested positive, but it wasn't the primary reason that they were being in the hospital to begin with. So no, we're not seeing that level of illness, serious illness. One thing that's really confounded our ability to understand exactly what the case rates are is the fact that there's a wide availability of at-home test kits. So there's no question the rates are higher than what we're seeing. So keep that in mind as we look at the data that's being reported by the state. Our maps that are in the report that are circulated show that Fairfield County and Darien in particular are in about the highest rate category of positive cases as defined by CDC. We're still seeing what we feel as considerable transmission within families based on the age groups. And again, as I said, we're seeing positivity rates increasing. I'm not sure what's going to happen this week. I'll know tomorrow. CDC is encouraging second booster shots. So for everybody who's gotten their first round of booster, booster now, encouraging, it's not a requirement. Those 50 medical conditions have second booster.
David is not having a stroke. He's just in the middle of Long Island Sound.
Hey, Jim, would it be better if he turned off his video and just did audio?
No, the cell phone signal is the cell phone signal, I'm guessing. He'll be back.
Yeah,
oh, we lost him.
Lost him totally. Oh, okay.
I'll make an edit here if necessary when he comes back, unless we have other business to conduct here.
Oh, there he is.
Oh, there he is. He's back. You're back, David.
Yeah. Yeah, I'm back. Didn't go very far. Sorry. As I was starting to say, I think we're talking about we're not offering vaccine. We're not planning on offering vaccine at this time through the town or through the health department. There's so many other places where people can get vaccine that are close by. I think we counted 52 locations within 10 miles of Darien, and most of these facilities are open every day, 7 days, some 7 days a week. So you can easily get vaccine in many, many locations, as opposed to our facility, which may be open only a couple hours, once or twice a week. We also ran into a problem when we did the vaccines in the fall, where we didn't use up the allocation of vaccines that we had because the demand kind of dissipated, and we had quite a bit of vaccine that expired. We were unable to give. We did give some to Grebes and some other locations, but we were unable to move the amount of vaccine that we had, and I don't want that to happen again. I don't want to have that kind of waste. So we're encouraging folks. We have on our website locations where people can get vaccine if they need it. We still do have 2 test locations in town, one at the church, St. John's Church on Post Road, and the other one's still operating at Leroy West parking lot. So we're pleased that those facilities are still operating. And of course, we do have the at-home test kits that are available in our office should anybody want to take them home and get tested. Let's see some other highlights here. As I said, our weekly summaries are posted on the town website, it's the health department website. Since January this year, we've held 4 clinics and administered 250 boosters and 150 pediatric doses of vaccine. That is where we got stuck with a lot of vaccines that we were unable to administer because they expired. So I don't want to have that happen again. Of course, we know the mask mandate in schools has ended. I've been asked, what do I think about with the increasing number of cases? Would we recommend masking, say, for example, in town hall and schools? And my reply is that I don't see us doing that unless we ended up having severity of cases increasing, and or if we had so many positive cases in town, we were unable to, or faced with the possibility of not being able to operate and keep town hall open. And we might start looking at doing masks. But as mentioned earlier, there was a judge who ruled that, recently ruled that it is unconstitutional for CDC to have a mask mandate on mass transit, trains, boats, ferries, and so we'll see how that plays out. But at this point, I don't see us needing to reinstitute a mask mandate. And testing facilities, yeah, sure.
And this is just a generic question because I haven't paid that much attention to it. If you're exposed to, if you go someplace and there's coronavirus around, how many days before you would show symptoms? Is there a real answer to that, or is that it depends?
It's that depends, but what we're saying is that if you wanted to get tested, or if you're going to develop, testing is like 3 to 5 days after an exposure to a known case. So that would be about the same period of time when you might see symptoms.
Okay. Thank you.
You're welcome. As of last Wednesday's phone call with DPH, there are no confirmed cases of the most recently discussed variant, the XE variant in Connecticut, but that doesn't mean it's not here. They just haven't found it. And not everybody who's tested gets screened for variants. That's something that's done on a random basis, and it's far less than the number of tests that are being done are being typed for the variants. It's a specific test, and it needs to go to a different laboratory. It's not done at our clinics where they're actually doing the testing. I think at that point, that's all I have to say about COVID. So I guess I would ask if there are any questions about COVID.
Did you say that they're home testing, you have home testing kits available in the health department if we want them?
I did say that, yes.
Okay.
David, the test to treat option, is that being exercised locally around here?
Yes, we have on our website the locations of all those facilities. There's quite a few of them, including, I know that CBS has it. I know that Reeves is about to initiate it. And there are quite a few places, both in Stanford and in Norwalk. Primarily the CBS is in the Walmarts, the larger places. And just recently, the state has reached out to the independent pharmacies as well. So yes, and that was going to be, I did see that I had missed that one. Jim, thank you. It was a bullet point.
Do you want to
It's on our
explain how
website.
that, you want to explain how that works?
It's a little complicated, but I'm going to simplify it as best I can. Depending on the facility, and if this is provided, you can go in, get tested, and if you test positive, you can receive an antiviral right then and there. Not all places are able to do that, so you might have to. In some cases, you can get tested and have your doctor call in a prescription. So, like everything else with COVID, it's not clean and simple, depending on the location you go to. But yes, and it should be done right away. So if you get symptoms and you want to get tested, don't wait. Don't delay, because the quicker you get the antiviral, the better and more effective the medication is.
So does that mean the antivirals are prevalent? I mean, they're available now?
Yes, more so than they've been before. That's why they're even opening it up to the independent pharmacies. I don't think when they first started doing this, they were targeting the areas that had very low vaccine rates, because they wanted to try to prevent, again, that crush on the hospitals. And they found that there really wasn't a tremendous demand. They have quite a bit of it left, so now they're really expanding. I had asked for this several months ago and was told not yet. It wasn't enough.
And
Now there is.
it's called test to treat. Is that what it's called if somebody who's looking for it?
Yes, and again, we have a locator on our website, so people can go in, type in the Darien zip code, and you can see the facilities that are located in the area. And you can contact them to make sure that you understand the details.
And do they do the PCR test or do they do the at-home test when they do that?
They would do the rapid PCR test.
David, as far as hospitalizations statewide, is it pretty low everywhere?
Yeah. It's one of the reasons why we relaxed the mandate, the mask mandate, so substantially. One of the reasons. I mean, there's several of them, but we're not seeing that severity of illness that we did the first time around, and a lot of that is being attributed to the fact that people are vaccinated. So and nobody ever promised that if you got vaccinated, you never would test positive. What the argument was, if you got vaccinated, you wouldn't get as sick. So, and I guess that's what we're seeing.
Okay, any other questions for David?
I guess one point might be, that I was not aware of the test to treat concept. And I'm wondering if that should be announced in the RTM meeting tonight, which is kind of, I mean, I'm not sure who would do it. David, I'm not asking you to be more committed than you are. And I don't know, I just bring that up. Do people need to know that? Or is it, we put it out in some other way? Or maybe just release it to Darionite and Darien Times and things like that.
Well, as I said, we have it on our website.
Okay.
The state has announced it through several venues, but I don't know how we could make sure that everybody knows that it exists. We can encourage people at the RTM to review the town and health department website for updates on COVID. Just as a matter of, their own personal edification. I don't know. I've always wondered about the best way to communicate across the board.
David, I'd be happy just to, if I can jump in early and with announcements and just make an announcement to remind everybody to look at the town website for the most current information on COVID.
That sounds good. Thank
Maybe
you.
send Seth the text to ask him to make that announcement as part of his announcements. If we have a few minutes, because he has it on the agenda to do announcements.
Okay.
All right. So I can talk about a couple other issues. This is the time of year when we start gearing up to do our seasonal work, which includes beach water sampling, which we do once a week from Memorial Day until Labor Day. We work with the Parks Department to, if necessary, close the beaches after heavy rainfall. We found that over the years, when you get over an inch of rain, that the bacteria counts are high. And without knowing exactly where the bacteria are coming from, we do this kind of proactive step to close beaches after an inch of rain. We also inspect public pools, and that includes condos and the clubs. This is going to be pretty soon. We're headed into mosquito season. The State Department Agricultural Experiment Station has 2 collection sites for mosquitoes in Darien. And every year we do find that we have West Nile virus mosquitoes in town. We're watching for, any new varieties of potentially causing viruses and mosquitoes. And when we do find something, the state lets us know right away, and we put out press releases kind of warning the public. Same thing about ticks. Submit ticks to the Agricultural Experiment Station. We're seeing more and more different types of illnesses associated with ticks, not illnesses per se, but viruses. And it's sort of along the lines of seeing types of viruses in ticks that used to be more south. But because it's getting warmer, seeing different types of viruses and ticks in Connecticut that we didn't used to see. Same with the mosquitoes. Radon. We just completed a radon test program in conjunction with the State Health Department, where we provided free test kits. This year we gave out 73 test kits. That's the most we've ever done. And that was all we received from the state. And we got more than, 73 kits. Of the 73 kits, 78 was actually, not almost 80% of those were tested. And only 3 were found to be above the 4 picocuries per liter, which is the EPA recommended limit. And those that were above that we're not that much above it. So, we've been doing this for 5 years, and what we've established is we in Darien do not have a widespread problem with radon in homes. That's really good news, because not every community in Connecticut can say that. And that's just a function of
Sorry.
radon is associated with shallow to bedrock foundations, and we have those. So it's a little surprising in a way that we don't see more radon, but that's just the way it is. I'm happy to report that. Any questions about that environmental program that we have? Seasonal snack bars, we do that. We will be inspecting those, as well as all of our restaurants, which we currently do. Any other questions about our seasonal activities?
Well,
So-
David, one thing you mentioned is that you're going to be using a student intern again, which is terrific. You also mentioned the community health assessment, and the last one was done in 2017. Are we overdue to have a new one?
I don't know if we do, but I think it's good to get an update. And we will be utilizing a high school senior, part of that intern program, which have been put on hold for the past 2 years. We've had really good success with kids in the high school program, being very helpful. And this young lady is, she actually founded this school's a committee on cancer awareness. So she's really focused on cancer, which will be ideal for what it is that we want to do as far as getting a handle on tumors and cancer registry numbers in town, so that we could really see what's happening with those issues. So yeah, I'm pretty excited. I'm excited about getting to work on that program.
David.
I think yes. Yeah.
Oh, David, I was just going to say, I think the last time we heard from you was just as the budget process was beginning, and you had made a strong case for adding staff among your health inspectors. The budget making process, I have lost track of, at least your piece of it. Do you know how you came out of that process? I don't know whether you got that staffing that you were hoping for or not.
I did not. And part of the reason for that was my justification was to stay ahead of the considerable development that's going on in town, in particular, the service establishments, food service and whatnot. And the thinking is that those places aren't going to come online for a year or so.
Mm-hmm.
So maybe it's a little premature to add a full-time person at this time, but that depending on what happens over the course of the year, I was assured that if we started running into difficulties maintaining what it is that we're mandated to do, that issue could be revisited even as soon as mid-year. So, and there were hours that were added to the part-time people to help out, at least in that part. So I think we're okay, but we didn't get that part. We did get approval for the software that we had requested, however.
To be able to take credit cards for certain
Yes.
things?
Yes.
Good.
We do a lot of permitting, and applications for food service restaurants and salons and so on. And for everyone to be able to, do this online would be very helpful. I've also just been notified by my computer that my battery is running low. So, I don't have a cord here. So let me see if there's anything else that's important. We are staying current. We're staying current with our food service inspections, and and I just did a introductory piece of video for the Thriving Youth Organizations campaign, informing parents about the dangers of marijuana, and we're going to be doing some more work on that in conjunction with the legalization of marijuana, some more awareness outreach.
David, another topic I put on the agenda was a discussion of the mental health first aid training that's coming up in June. Are you involved in that? That's at post 53.
Yeah, that was not. Yeah, no, we're not directly involved in that.
Okay.
That was more through the
Human services.
Human services. Yeah, Allie's been
Okay.
really working on that with Monica.
Okay.
Not that we've also been peripherally involved, but we're not the drivers. We're not the drivers in that. Human services has been.
I think it's good. There's been a lot, it's been in the papers. It's on the town website. So I think it's the information is out there.
It's a priority, and we met today meaning Monica and Kate and I and Allie and the chief of police and we met with Silver Hills because we're looking at doing a co-op with New Canaan to have some emergency kind of resource to direct people in the event of a mental health emergency. So, and perhaps using some of the ARPA funds for that. So we're looking into that. I think it's really essential that we do something like that.
That's great.
So with that, I don't have anything further to add.
I have another question. I've read some stuff about they do water testing to see if COVID's in the water.
In the sewage, actually.
Yeah, in the sewage. And I was just wondering if that happens here, but we just lost David. So to be continued.
Lois, I can't speak for Darien, but I'm pretty sure they do it in Stamford.
That's where sewage goes. So
That's right. That is where our sewage goes. Okay. Thank you.
of course, it's not, once it gets to Stamford, it's not differentiated as to whether it's Stamford sewage or Darien sewage.
Right.
It's all just effluent,
Well, I apologize for the audio, disconnections, but I think that went pretty well. Hopefully,
Mackey's back.
Oh, good.
Battery is on fumes probably by now.
Yep, he's gone again. Oh, no, there he is.
There he is.
So technology is a wonderful thing. So my computer went dead, but my phone is here.
Good for you.
All right. So anyway, you were starting to ask about the wastewater testing, and yeah, that's being done in various locations in Connecticut. I'm not sure how many, 6 or 7. And I guess the thought is that you can kind of predict. It's another measure of trying to get a handle on when COVID counts are going up, depending on what they find in the wastewater. We're not doing that. And I think Stanford is, but the problem with doing that is you don't know where it is. You have a large collection system and, I don't know. I think it has limited utility, frankly, but there are those who think it's great. So it's being done.
David, overall, it sounds like you're cautiously optimistic that the worst of COVID is behind us. Is that oversimplifying your thoughts?
Yes. No, it's not oversimplifying my thoughts. I agree. That is my feeling on it. I am on the ferry and I'm not wearing a mask, Jim. And, in part, it's because I wouldn't be able to carry on this conversation very clearly. But I can tell you that nobody on the ferry wears a mask, not even the people who work here for the most part. Can't use that as a gauge so much, but, I will say that I would wear a mask use myself as an example. I will wear a mask on the train, even if they say you don't have to. I'll wear a mask on a plane. I'll wear a mask if I'm in a crowded indoor area. And I'm going to avoid concerts or things like that for a while, or events where people are really crowded together because, I'm a risk age category and I don't want to get it, even if it's maybe a milder version of what used to be. So yeah, I'm optimistic. I've been optimistic all along though, I get a little concerned in December, but again, watching hospitalizations and knowing that those numbers are not going up dramatically does provide me with a sense of comfort.
Thanks.
You're welcome.
Can I ask a question back to the mental health? Can you just talk to what other things the town is doing, re-educating or campaigns or whatever regarding mental health? I know the schools are working on it, but it seems to be a big issue that's affecting all ages. And I'm just wondering if there's plans and what we can do to kind of help.
Yeah, that's not being done through our office. It would be, again, it's through Human Services.
Okay.
So I can't speak to that directly.
Okay.
Okay, well, David, well, thank you. Really appreciate your time and under these conditions, it was a good discussion. So thank you.
You're welcome, and we're just coming into port. Perfect timing. Thank you.
Thank you.
Good night, all.
Okay,
Good night.
bye-bye. Okay. Well, let's see. Let's quickly go. We'll go back to approving the minutes. We do have a quorum. And any discussion of the March 16th minutes? That was our joint meeting initially with finance and budget, and then we had our own meeting. Anybody opposed to approving the minutes or abstentions?
Mac, I'm
Yeah,
going to abstain because I wasn't at the last meeting. It's Brian.
Okay, all right. I think otherwise we're all in favor of approving them. Okay. All right. Lois, you wanted to talk about
And we treasure cloudy
the email addresses.
Okay, so I would just like to take, as long as we have we'll do it quickly. I just want to gather information. Some of us have, the tech committee is starting to talk about email addresses just out of curiosity because it always comes up. And I did a quick analytics on the RTM email list, and 80% of the people are not using DarienCity.gov. It doesn't mean that people don't have unique RTM addresses. They could be RTM Gmail things, but they're not DarienCT.gov. And so what I'm interested in, which if we continue and try and get some more information on this, we may put out a survey to try and find out, get some more information from people as to why. But I thought I'd use our group as a sample does anybody have reasons why they're not using DarienCT.gov? So I have a feel for what, why. Jim?
It's kludgy to access that mailbox. I think I'm no tech whiz, and it's hard for me to set up Gmail to come into my Gmail box, let alone add another domain name. I've tried using the town's Outlook package, and I just find it hard to use. So I know I'm rolling the dice. Somebody's going to FOI me one of these days, and it's going to be a laborious process culling out all the stuff that they're looking for to the exclusion of all the rest of my stuff. But it's kludgy. I think if IT made it simpler to be able to retrieve that mail, I might use it.
And is that because you have to use Outlook to get at the mail?
I don't know if I have to use that. Well, I don't use Outlook. That's
Right.
my other problem. I use Gmail exclusively.
Okay.
And I don't know how to add a non-Gmail. I don't know how to do that. I don't know how to access it. I don't want to have a mailbox I'm not going to be able to access. And I would guess that there are many people. I have a DarienCT.gov email address. I haven't looked at it for years, and I don't even know what's in there. And I don't want anybody to assume that I'm looking at it.
Well, just so you understand, this was prompted by something Max said, that one of our members of our committee was new and for 3 or 4 months did not know that stuff was going to DarienCT.gov and wasn't notified of the meetings. So,
That's Michael. Yeah.
well,
Wow.
I didn't even know it was an option. I didn't know that we could have a DarienCT.gov email address.
well, everybody has a DarienCT.gov email. It doesn't mean one uses.
Okay, I didn't know that, so I didn't know that I had that.
They're automatically assigned.
Yes.
Lois, I
Everybody
don't
has
use
I
it.
didn't know that.
And are
I
there
don't-
directions on how to access it somewhere?
As
Good
I
luck.
said, I'm starting to ask.
Good luck.
I have no answers. I am not high on this list.
I don't use it because I have my personal email and I have my work email. So that's like, then I would have a third email. So I just keep the two.
Yeah. I got 4 emails already. I don't need a 5th.
Well, what I did was way back when, it may have even been before we had the town email addresses. I just created a Gmail for my RTM
Right.
business, and that's what I use. And I've just kind of always done that.
And again, for anybody that's new, the only reason to want to do this would be to segregate your town RTM email from everything else. Should you unfortunately be part of an FOI suit, which somebody says, Jim, Cameron, give me all of your email relevant to topic X, related to RTM business. And then a month later, I will dig up the last piece of that and send it forward. But if it was all in one specific email, then you'd know where it was. And they wouldn't be able to access your work account or your personal account.
Well, as Lois knows, my pet peeve has been for some time that on the town website for RTM members, our email addresses are not listed. To me, it's just every other town official has one listed, and not us. And I don't get that. I mean, there was a time when everyone was concerned about privacy, but we have our home address is listed on there, a phone number is listed, but why not the email address? That's been something I've been, hoping they'll be corrected at some point.
Mac, it's very spotty. There's lots of boards and commissions that don't have either email or a phone number, let alone an address. They just have a name, and there's no way. I think that's irresponsible. I think citizens should be able to contact
Yes.
elected and appointed officials to spew and be heard. And you can't do it using the town website.
Right.
But that's a policy decision that's got to come from higher up than
Well, just
us.
some things that we did, we've looked into this and just to gather information and things. And the concern was the ability to be skimmed, to have the email addresses just go off into things. I personally looked at a whole bunch of towns with RTMs and to look at who has it posted and who doesn't and things like that. Found it half and half. Greenwich had it behind a code that you had to get. You had to email and get a code, and then you could get at the list. But the truth is that you can, if you send something, there's on the email, on the town site, it says if you want to send something to all RTM members, you send it to this address, which is Krista. And if you wanted to send something particular, you could email Krista and ask for somebody's email address. So it's cumbersome. It requires somebody to make a real effort to do that, but it's not like you can't get it done. But that's, so that's where we are on that. I think the difference is that like Monica is on it all the time. And that's why having a DarienCT.gov address works for somebody like Monica, because they use it all the time. If I'm going to get 2 a week, I'm probably not going to get into a DarienCT.gov. nor do I want other email, my personal email going off into some place that can be scanned or skimmed or whatever the word.
Scraped.
Scraped. That's the word. I knew it started with an S. Yep, scraped. So that's the answer to that. I think the issue, I'm back on what we started this conversation about, email addresses in general and the use of DarienCT.gov. I think I would like to try and get some specifics on why it doesn't work for people. And if it's something that it's because we don't understand how to make it work, like in other words, you don't have to use Outlook, you can use Gmail or something like that. That would be useful information. And if it doesn't work because it doesn't work, then I think that's useful information for the town to do something about it. So I think.
Lois, I think there's a way to do it. I think there's a way to do it because my office, like when I go into my iPhone, I can look at my Gmail and then my work email on the same, like on the same icons, but my IT did it. I didn't do it. They did it for me.
So, and I
Well,
don't
call
know.
Holly's IT. They'll fix that up.
I don't know if, how far we're going to go with this, but I found it interesting to know that 80% of the people are not using DarienCT.gov. So
can you go onto the website, the town website, and access your email through that? Well, if you did that, I bet you more people would use it.
There's a web version of Outlook that you can use like on the website, like you go to Gmail on a website too, and you could access it there, but you gotta know your way around.
And I know, some people I've talked to that if you want to send it to a number of people or create groups and things like that, you have to really know what you're doing. And that's not going to be particularly useful for all of us. We want it to be really easy. So, and my concern is more at this point, a lot of us have it the way it works, and hopefully we're not going to get FOIA things. But for new people, I just want to make sure that they don't get lost like Michael did, where he couldn't have access to, he didn't know he had an email that he was supposed to be looking at. And so he didn't get the information he needed. And that really can't happen. That's just not good.
Well, I think it was even more, it was a, Michael's, his wasn't even activated. He was given the email address, but it wasn't activated.
Right.
So he just,
Yep, but I fixed it because I just used just look at Gmail now. I gave my Yahoo account. I gave up.
Now you understand how we all got to where we are, but I'm not sure that I would like that not to happen to more people.
That's good.
Thank you.
okay, well, thank you, Lois. I think that's really it. And any announcements? I think we'll go ahead and adjourn and prepare for our next meeting. I want to thank everybody for being here.
Stop recording.
A motion. Yeah. Well, I officially should ask for a motion to adjourn.
So moved.
Second.
Okay, second. Okay. Any opposition? Any abstentions? Okay, I think it's unanimous. We're in favor. So thank you, and we'll see you in a few minutes at the full RTM meeting.
Thank you.
Thanks, Matt.
Thanks, Mac.
Thank you.